We're back. Welcome. It's Tuesday, day 3 of the Weiner Wellness Week. We've had a full show so far. Lots going on. And today's roundtable, we have the heart and soul of the world of wellness, our two practitioners, Dr. Gideon Orbach and Dr. Phil Ross. So when we've got both of these guys on stage at the same time, we've got a lot of brain picking to do here. Okay. But of course, what's the biggest topic? Pain, inflammation, mobility. I mean, all of these things. And you guys see such a variety of patients with these conditions on a daily basis, right?
Yes.
So, I mean, where do you think we should start? Should we start with severe pain, with aggravating pain, with maintenance?
Actually, Joe,
what do you think,
for the
Doc?
first time in how long have we been at it? 15 years?
Yeah.
For the first time in 15 years, I'm going to disagree with you. I think I think the place to start with is function.
Function.
Yeah.
All right.
Yeah.
That's why you guys are here. Let's go.
Or in some cases, the lack thereof, and in
All
some
right.
cases, the restoration thereof. But before we even take any kind of a deep dive into that whatsoever, I have to congratulate my colleague, Dr. Ross. He just finished his CCSP, his Certified Chiropractic
Thank
Sports
you.
Physician.
Yeah.
It's a big time achievement, and something that we talked about briefly this morning on the roundtable discussion was you see these chiropractors, especially. I mean, this is the profession I'm familiar with. I'm sure every profession has it. These people have alphabet soup after their name. They go to a 12-hour workshop and get certified in something that may or may not exist, and they stamp it on their card. The program that Dr. Ross did, I mean, that's years of study and a very, very difficult, strenuous examination. And he, big time for him. Congratulations.
Appreciate that.
Awesome.
Yeah.
Great stuff.
So,
And, you know, he was very low key about it. You know,
that's what we like about him.
Yeah. Hey,
Yeah.
look at this, guys. Now
Right.
you got a new plaque in your office.
Not yet. It's in the mail
It's
right
in the
now.
mail.
but
Check's in the
yeah,
mail. Check's in the mail.
that was the purpose of the master's program, so I could sit for that CCSP. So appreciate
Yeah.
that, guys.
All
Yeah, that was
right,
big.
good.
Yeah.
So I have a mentee he's a student intern at this point in his training, and he and I are in communication by text and by FaceTime, and we use the technology to our advantage. And as a student intern, you know, he's just in his very, very initial phases of treating patients. And I mean, I know you remember those days. I remember those days that you do nothing unsupervised, and they watch you like a hawk. And anyhow, you have to explain everything that you're doing and the rationale and the this and the that, and it's a production. So he's super excited that he has he called her his first real patient, and he describes this woman who's getting migraine headaches, and she'd seen a number of different practitioners, not just chiropractors, but physical therapists, people in the medical world. And so my mentee Matthew, he started adjusting her feet, and so it was the first time she started to get any kind of relief from any kind of treatment at all
From
And-
migraines.
for migraines. And
Adjusting
so
her feet.
okay, and so what I think, I mean, he's a student intern, and this is his first time he's adjusted people's feet and start to see benefits and changes in their systemic health and something so drastic as a migraine. And he is excited and he is jacked up, and he should be. I'm 20 years into this. I'm spoiled rotten. I expect those kinds of results. Okay, I know that you're somewhere in between, right? So let's just take a short dive into what's going on here with the biomechanics, with the function, with the neurology, and let's figure out exactly what it is that this future chiropractic hotshot is doing that's working so well. So if somebody has a migraine headache, more chiropractors than not will say, well, it's coming from your neck. And they're not wrong. They're not. That's a very good way to begin an approach. But as I mentioned so quickly on our morning roundtable, I have this mentor in New York, in Jamestown, New York, named Ken Erickson, who he teaches more than anything. He teaches a thought process. He teaches like how do you approach a problem, whether that problem is this patient's symptomatology or whether that problem is the electrical wiring in your house. Either way, a problem is a problem, and you have to begin by, well, what's causing this, or what went so wrong that it allowed the circumstances to happen. I mean, and we're going to start with that as a fundamental premise. And when we say somebody's having migraines, I think the place to say is that this migraine, this super intense headache, what it is a symptom of central integration. That's how your brain is processing stimulus gone wrong. So either something happened that caused our sensory experience to go downhill where we experienced a migraine headache, or some system of checks and balances fell out of place, and now the migraine that we all might have silently and not even be aware of is not being suppressed by our nervous system. So first we have to make that determination, and then we have to walk down a pathway and figure out, well, what are we going to do to establish a definition of the problem, and how are we going to interact with this patient's whole nervous system, their biomechanics, their physical function. What are we going to do to restore their physical function in order to excite their nervous system to inhibit the migraine headache? Now, what my guy Matthew saw was, look, here's a patient, a person, a human being who's wearing shoes that are just, they don't look that comfortable. They probably have an elevated heel. They're tight. They're compressing the 28 bones of the feet. 26 of them are movable. If a bone is movable, that means they're adjustable joints from a chiropractic perspective. And nobody's ever looked at this. So when we think about what are we going to do to stimulate the nervous system, as chiropractors, we have one very powerful tool, and those are the pressure-sensitive mechanoreceptors that live in joint complexes. A joint complex is where two bones come together. It's wrapped up in ligaments. Ligaments are connective tissue that connect bone to bone. So what we want to do is we want to mobilize those joints. We want them to get unstuck. We want to restore proper ranges of motion. And when we do that, those mechanoreceptors are allowed to do what's called depolarization, which means that they're going to become excited, and they're going to start to they're going to bombard the central nervous system, the spinal cord in the brain, the somatosensory cortex, the part of the brain where we receive information, sensory information from the body, and we're going to start to elevate the firing, the frequency of firing of the brain itself. So what's the big deal? If we have tissue destruction, if we have joints that are being compressed in tight shoes and an elevated heel, forcing us into aberrant postures, loss of function, instead of firing off those pressure-sensitive joint mechanoreceptors, what we're going to do is we're going to excite what are called nociceptors. The nociceptors are harmful. Nocere is the Latin for harm. And that's going to start sending the brain signals. It's time to start experiencing pain. So what we want to do is we want to inhibit nociception and stimulate pressure-sensitive joint mechanoreception. Now, we talk about nutrition all day long here. Nutrition is supremely important, but it doesn't make the kind of what are called neuroplastic changes in the brain the way chiropractic adjustments and even to an extent muscle therapy does. And as I hope you'll take a deep dive into to explain the application of the laser as we get to that point.
Absolutely.
So what we're doing with making these adjustments to the feet, Matthew used a protocol that I've been using for years, that the Motion Palpation Institute has been teaching for longer, that I know you use elements of with your patients.
Yes.
And it's not simple. Don't try this at home without proper training. But it's a simple protocol that really we can teach chiropractors how to use in an hour. Mm-hmm. So Matthew was able to make adjustments to the feet, areas of the body that had become dysfunctional, that had become overly populated and overly stimulated in the nociceptive component, underrepresented in the joint mechanoreceptive component. And in turn, what happens is these joints start to excite what are called C fibers. C fibers are a name of a specific diameter type of size nerve in the nervous system. And what those C fibers do is they conduct pain sensations into the spinal cord and the brain. C fibers are fairly small in diameter relative to the rest of the peripheral sensory nervous system. And because they're small in diameter, that means the transmission is slow. So have you ever had the experience of stubbing your toe and thinking to yourself, oh, that's going to hurt? And a few seconds later, that hurts. It's not immediate. That's because of the slow transmission, the very slow transmission of the C fibers relative to the rest of the sensory nervous system.
All right, now it's my turn to disagree because every time I have stubbed my toe, that hurts immediately.
Well, you might have a more active nervous system than everybody else we know. I mean, we've been plotting and discussing and analyzing you, and we think your nervous system is just a little bit more hyped up than everybody else.
Could be. Okay.
Now, I'm going to turn this over because Phil has so much more. Dr. Ross has so much more knowledge about the laser and how it interacts with the nervous system and what it does with those C fibers. And I'd like you to take over the discussion. But before I do, I want to bring out one last point about the importance of shutting down these C fibers.
Mm-hmm.
C fibers, because of the diameter that they are, form what are called artificial synapses or ephapses with the nerve endings that are involved with the sympathetic nervous system. So if we have too much nociceptive bombardment because of a lack of mechanoreceptive involvement, and we've excited the C fibers, and the C fibers start to activate the sympathetic nervous system, let me ask you, what percentage of your patients do you think have anxiety, panic attacks, insomnia, high cholesterol, poor digestion, high blood pressure, elevated cholesterol, increased blood pressure? That's the whole sympathetic nervous
that's
system.
100%
right
of them.
And that's the only part of your notes that you actually wrote down.
Yes, yes it is. Yes, it is. Yes, it is.
Okay.
So
let's just one more last point before we turn it over to Doc, and that is what I just heard is that pretty much every woman out there that wears a pointed toe, high-heeled pump should be having migraines.
okay,
Probably does to an extent.
probably does to an extent.
Should be getting their feet adjusted. Right?
Is Dr. Orbach saying that compressed feet cause migraines? Well, in some cases, yes, it does.
Okay.
Yes, it does. In all cases, no. Does everybody who have migraines, would they benefit from having chiropractic adjustments to body parts that have lost function, but are not necessarily traditionally thought of as part of their genesis of their migraine? Yes, he is. That's exactly what I'm saying.
Absolutely.
Yep.
All right, great.
Because you're exciting the brain. So when we were just talking about the mechanoreceptors, when you have like a locked up joint, so to speak. So we were talking about the joints in the foot. Your brain thrives on stimulus. If you don't give your brain the stimulus, that's when certain damaged tissues start releasing certain chemicals, and you get the sensation of pain. So most of the patients we see coming in, well, for the most part at first, are coming in because they're in excruciating pain. So we're going to kind of dive into pain, and then we'll kind of touch base on the C fibers. There's another kind of pain fiber too. It's called the A delta, and we'll talk about why when you stub your toe, you feel it initially at first, and then it kind of turns into a lingering dull pain. Yes. So the technical definition of pain is distress feeling caused by intense damaging stimuli. So it's basically like an alert bell for your brain saying that there's any kind of damaged tissue. And what happens is then you're going to release, there's mainly 8 inflammatory proteins that get released and then signals to your brain, hey, we have something going on here. So long story short, there's 2 different types of pain. And what Dr. Orbach was talking about was the C fibers. So the C fibers are smaller in nature. They're non-myelinated. And the type of pain that's going to be like dull, aching, and like a diffuse pain. So like across my whole upper back, I'm having some pain. So that's more kind of chronic. The A delta fiber, that's called, they're myelinated fibers. So if you're at the airport and you were trying to get to your gate, A32, when you jump on what's the fast walkway called? That's
the fast people mover.
Fast people mover. So if you kind of get on, on that fact track, that's basically, it's just quicker to the brain. So that is when you stub your toe initially. They're larger, quicker fibers, larger in diameter, and that's kind of like your sharp stinging and just well localized pain. So, doc, I'm having shoulder pain, and it's right here after I did something trimming my tree over the weekend. So those are the 2 different types of ways that your brain will perceive pain, and both of them terminate in the dorsal horn of the spinal cord. So long story short, how this ties into chiropractic. When you're having pain, peripheral nerve fibers end in your spinal cord, and when you receive a chiropractic adjustment, it instills what's called the parasympathetic nervous system. So sympathetic, parasympathetic. Sympathetic, you see a bear in the woods, eyes dilate, everything vasoconstricts, blood pressure goes up, heart rate goes up. Parasympathetic is rest and digest. So after you eat a meal, you're sitting on the couch watching TV. That's kind of how your body reacts. So when you get your certain segments of your spine adjusted, what it's going to do is it's going to downregulate the C fibers and the A fibers, so you actually have a decrease in pain. Correct?
Exactly. That's
Yeah.
very well said.
Yep.
That's very well said. When you think about the sympathetic versus the parasympathetic balance and the way chiropractic adjustments stimulate not just the joint mechanoreceptors to act in the somatosensory cortex, but also all the connections between those mechanoreceptors, the somatosensory cortex, and the cerebellum. We know that the cerebellum is the part of the brain that's responsible for coordinated movement. But what it also does is it inhibits the sympathetic nervous system. So when we think about doing balance exercises, we're challenging the cerebellum. We're also doing exercises that inhibit that anxiety, increased blood pressure.
Yes.
The bear, I saw the bear, should I run or should I hide?
Yes.
Attitude.
Yeah.
Our cerebellum is going to diminish that. So I know that in past presentations, one of the things that I really like to focus on is let's all do some deep breathing exercises. The area of the brain that's most susceptible to oxygen deficit that will go hypoxic the soonest is the cerebellum. So when you see a field sobriety test, when you see police officers checking, like, yeah, I don't know if you should be driving right now, let's have you do finger to the nose. They're essentially doing a neurological exam for the cerebellum to determine, did you drink enough alcohol to kick the oxygen out of the cerebellum to inhibit your balance? That's what's going on here. So when we talk about making these adjustments, doing chiropractic care, and taking care of our patients this way, I mean, I know from my own personal protocols, and I know from what you're doing, is what an incredible role that we use balance exercises and deep breathing exercises for, regardless of somebody's condition, whether you sprained an ankle, whether you sprained a shoulder, whether you have migraines that are triggered by any number of environmental factors, including the high heels. Regardless, there are certain universal principles that we have to employ for good, successful rehabilitation. And good, successful rehabilitation is a complement to the treatments that we do here in the office. And I mean, I'm a curious guy. I mean, I study this stuff on my spare time. I network with people who do all this stuff, but one thing that's just so foreign to me is laser treatment. That this is something so new to me that I know that you have an area of expertise in, or you're cultivating an expertise. And I heard you talk about the laser and how it increases mitochondrial activity, and how it helps to diminish C fiber activity.
Yes.
So, I mean, for my benefit, as much as for everybody else who's listening in, man, I'd love to hear a couple minutes about your expertise with the laser and what you're doing.
So
treat people with it.
Let's dive into it. So we'll start kind of umbrella with the modulation of pain.
Mm-hmm.
So when you have any kind of pain, we were talking about that chemical soup, the main inflammatory proteins that are getting released when you have any kind of damage to tissue. Long story short, inhibitory neurotransmitters, serotonin, GABA, which I believe we have in our Calm Day, correct?
Yeah.
Yeah. And endogenous opioids will kind of help to override your pain. So one of the best ways to have a natural release of your endogenous opioids, your natural feel-good chemicals, exercise. That's the easiest one. So it kills me when you got a teenager coming in and you're asking the parents, hey, so, Jimmy's struggling with, anxiety, depression. He's in chronic pain. What's going on? Well, he just sits inside and plays video games all day. Well, if you exercise, natural release of your feel-good chemicals, you're going to feel better and get out of pain. So that's one of the biggest ways. Another way to increase your endogenous opioids is like cold showers, cryotherapy. If you guys ever heard the cold chamber, you guys ever done it?
Yes,
No,
I have.
I have not.
Yeah, that is
Done a few cold showers.
absolutely. Yeah, that's another great way. A couple other ways to kind of like increase.
Let me ask you this first though: is it best to do a hot then a cold, or just right into the cold for shower? Like if you're doing it in the shower.
I like just straight cold.
Straight cold.
Yeah,
Straight cold.
Yeah. I like just straight cold and high intensity exercise. Getting more sleep. You got to have adequate sleep. That's how you heal. When people are coming in, how do you sleep? 4 or 5 hours a night. Not even close to enough. What do you think? 7, 8 hours?
At least.
Yeah, absolutely,
yeah.
at least. So those are just some of the ways that if you're in chronic pain, how you could kind of get out of your chronic pain. And then going back to like what the laser does. So The laser therapy, basically how that could kind of turn off pain. So we'll just take it's called a radiculopathy. So neck pain running down an arm. So when people say numbness, tingling in their hands, pain in their arm, can't get comfortable, can't go to bed, basically you have three channels on a nerve: a calcium, potassium, and a sodium ion channel. Think of a straw with a bunch of holes in it. That nerve's leaky. So what's happening is that nerve, you're feeling the sensation running down your arm. What the laser helps to do is to help patch up the holes in the straw, if you will, and turn off the calcium ion channels so you do not feel the radicular symptom running down your arm. That's one of the best ways it actually decreases
Yeah.
the pain.
Yeah.
Yeah.
Yeah. I mean, that calcium ion channel shut off mechanism is huge. I mean, you
Yeah.
think about the enormous percentage of patients that we see who we talk about, I have pain in a certain location and it travels to, and they point to something distant thereof.
Yes.
I
Yeah.
mean, that's almost everybody.
Yeah.
And
Now,
starting off,
let me ask you, what if it doesn't travel? What if it is sent exclusively localized? Is there a difference?
well,
And
there's no difference in the mechanism of treatment plan, in that what we're trying to do is we're gonna try and stimulate their central nervous system
Mhm.
using the tools at our disposal, reinforcing with exercise, reinforcing with nutrition.
Yep.
And if pain is local,
Mhm.
then my gut feeling, I mean, this isn't true in 100% of the cases, but my
Mhm.
gut feeling is good. You got here in time. You didn't let it fester long enough that it
Okay.
took on that traveling sensation.
And where we do great at it, so we were talking about the different channels of pain on the
Mhm.
nerve. So calcium, potassium, sodium. The potassium ion channel is actually turned off from decreasing mechanical irritation. So that's what we do in our rooms all day.
Yeah.
Whether
Yeah.
it's soft tissue work, adjustments, stretching, PNF. That's what we're doing. We're trying to
Uh-huh.
turn down regulate the potassium ion channel so you're not experiencing the local pain.
Right.
Absolutely. And going back to how pain is, the two different types, that's going to be your A delta. So that's the
Right.
myelinated, the fast track to your
Mhm.
brain.
Right.
So, do
Exactly.
you use the laser in both?
Yes.
In both.
Yeah,
Mhm.
absolutely.
Wow.
Yep. Just because it will decrease the inflammation as well.
Okay.
And that's one of the tissues. If inflammation of a tissue sends it through
Mhm.
the brain up to the thalamus, and then, everything goes crazy.
Right. And one of the things that I don't think gets spoken about enough about the laser is, as at its root level, the laser is it's light energy. It's
Yes.
photon energy, and,
Right.
and light energy moves in waves. It's a form of vibration. So when you apply the laser to, I mean, let's take our hypothetical patient with neck shoulder pain radiating down the radiculopathy or the traveling nerve pain into their forearm, even as far as their hands. When you apply the laser, there's certainly an element of very well localized treatment, but it's also systemic neurological treatment, because that light energy vibration is, I mean, we know that vibration travels along a tract in the spinal cord to the brain called the dorsal columns. Dorsal meaning like a shark's dorsal fin,
There it
right?
is.
It's in the back of the it's in the back of the spinal cord. And so we're making ascending information using the vibration. When you apply a chiropractic adjustment, there's a component of putting your hands or using a device
Mhm.
on somebody's body and creating a vibration. When you do muscle therapy, we push in, and a little more sophisticated than wiggling, but there's a little cross friction component, vibration. So the laser has beautiful application
Yeah.
locally.
Mhm.
It has systemic application when you talk about the vibration and how that's such a profound treatment modality when we talk about central integrative state, somatosensory cortex, thalamus. Think about the thalamus as the area of the brain is like your grand central station. Sensory information comes into the thalamus and it's routed to the specific area of the brain that deals with that function.
Yeah.
And I know, Joe, that you and I have talked ad infinitum about vibration in the past and
Sure
various
have.
forms of vibratory
Yes.
therapies. We talk about what can you do with a tuning fork. That if you hit the tuning fork and you put it on a body part, I mean, certainly that's a diagnostic tool to tell if something's been fractured. But let's take an even simpler approach. Even that's therapeutic, as we have ascending information traveling through those same dorsal columns, the same vibration into the thalamus, being routed to a different area of the brain than the vibration that comes from the laser.
Absolutely.
So I see, I mean, I've seen people who Look, I don't hit home runs for everybody. I strike out on occasion. It happens. It is what it is. And I've seen patients who, look, I worked with them for a period of time, and they knew that they weren't getting relief, and I knew that they weren't getting relief, and their problem still existed. I mean, maybe their problem was diminished, but it was still there. And I see them coming back. And do you think the laser is for me? Should I try that? And I see people signing up for packages and coming to see you repeatedly and leaving with a smile.
The results speak for themselves.
Right.
Absolutely.
I want to tell
Absolutely.
one particular one with this. What happened with this laser? This was a few months back, but a lady had come in and was asking for nutritional guidance for her kidneys, and she had said, she goes, "Well, I'm gonna have to go get get my kidney taken out, one of them taken out. I mean, it's like, it's so bad. The pain is so bad. Was there anything do you have anything for this?" And it was one side, it was one kidney, or supposedly. And I said, well, I said, before you go to any surgery, I said, let's just try something. And I saw Dr. Phil. I said, Dr. Phil, do you think the laser might be applicable here, or do you think you can help? And he didn't have any at the time. He said, sure, come on in. You had her in there. You tell the rest of us.
So, what is it? Murphy's punch, right, for the kidney, negative. So I didn't think it was kidney. So it was coming from other kind of structure. So long story short, what we did was we were talking about what the laser does for the calcium ion channel. She was having like a sharp stabbing pain. So we kind of reset the calcium ion channel. And then what we did for the potassium channel was just kind of like a light massage and just some soft tissue work, a little bit of grass and a little bit of stretching. And you saw her when she walked out.
That was
it.
Was like, she was amazed. We were amazed. Everybody was.
Yeah.
You weren't amazed.
I'm gonna lose my kidney, and then I'm good.
I'm good to go.
Yeah.
Right. And the thing about that, the sad thing about that is she probably diagnosed herself with a kidney problem based on anatomical location and probably based on Google.
Yeah.
And Google is, I mean, what a wonderful tool it is. Can we say, is the day long enough to say enough good things about Google? But sometimes too much information is too much information.
Yeah.
And I shouldn't be diagnosing myself, and you shouldn't be diagnosing yourself. That, I mean, I remember taking physiology and pathology, and me and my classmates and everybody, I have that. Do you have that? I might have this.
Yep.
Should I be treated for this?
Yeah, absolutely.
And so when patients come in and say, it's my kidney, like my first question is well, who examined you? Who diagnosed you with that? And as soon as they say, well, I looked online, like, you got to take people seriously. You don't want to be trite with them, and you don't want to undermine their experience, and you don't want to undermine everything that they're concerned about. But at the same time, you got to kind of talk them off the proverbial ledge and like, listen, look, from everything you're telling me, there's a very good chance that the kidney's involved. But I think there are other structures that are involved, and we're here to figure out what those other structures are and how to tie it all together. So I'm not even the least bit surprised that what wouldn't surprise me, though, is I'm sure there's a nephrologist somewhere who would have taken it out for her.
Yeah, we got to watch with Dr. Google, because you have a headache and you Google, here's my headache, and then you end up having a benign tumor in your head.
Right, right.
Yeah,
right.
so you got to...
So there's a delicate art to taking people very, very seriously, but steering them in the direction that the person who's accepting clinical responsibility and making clinical decisions and doing clinical applications and educating the patient, like that person has to assume some responsibility to steer the conversation and steer the treatment and steer what's going on with the whole situation in a more appropriate way that you might not find on Google.
So the laser, let's make sure everybody understands, Doc, is for soft tissue, right?
So it could be applied to certain different structures. So the best way to describe the laser is just how the sun hits a plant, so the plant could grow and repair itself. We're donating photon energy. It's called to your cytochrome C receptor in your mitochondria for you to heal. So we're trying to take where your body is, and we're trying to basically increase your healing capacity up to like 50 to 100 fold of what it normally is. So we're just trying to accelerate. And I always like to tell people, hey, I love seeing you when you come in here, but I'd rather see you at Giant Eagle or at a concert. You know,
Yeah.
I don't want to see you coming in here. So I try and get people in and out as quick as possible so they can live their life pain-free and improve their function. That's the biggest thing.
Exactly. I mean, I couldn't have said it any better myself. I mean, I want to see, I want to see somebody 10 times a year if need be. I don't want to see somebody 3 times a week and not even know what, like you were just here. I don't even know if the last treatment worked yet. I mean, it's too soon to say. Where do we get? And like when I see, if I have any patients who are watching this and I've seen you at Giant Eagle and you called, like, yes, I was ignoring you. Okay, it's not personal. It's that I'm a little, like, I got this little social awkward quality, and when I see patients out and about, it's like, are you my buddy? I mean, are you going to introduce me as your doctor to the people you're with, or you just my chiropractor? I'm trying to watch out for your privacy. I don't know where the beginnings and ends are, so it's a lot safer if I pretend like I have headphones on and I'm just kind of in my own little world. Don't take it personally. But you're absolutely right.
Yeah.
We want to see, like, every time we see our patients in Giant Eagle pushing their own grocery cart, lifting cases of water in and out of that grocery cart, when we see them at the public parks, running laps, walking laps, going for a jog, going through a hike, shooting, that's a testimonial to what we do.
Absolutely.
That's a testimonial to what we do. And then we just,
I have a feeling that when they see Dr. Phil out and about, everybody in the store knows it.
See me be bopping around.
Yeah, and he's like, hey, how you doing? How you feeling?
Well,
This is true. This is
he doesn't have the social anxiety that I do. My sympathetic nervous system needs to be dialed down so I can be a little more friendly to the people out in public, I guess.
Do you think that those music channels that you play are providing a positive vibration?
I think so. I think so.
Yeah?
This last week I was more 50s doo-wop and 60s soul was the tunes last week.
Oh, that's my era.
Okay, two very wise selections, and let's. I mean, you talk to people about what a passion music is, and what is music? It's what is noise? It's just vibrations in these. How does it hit your brain? And why is doo-wop? Why is that such a highlight for some people and ignored by? I don't know why anybody would ignore that, but some people, like, that gets them going.
Yeah.
Other people, like, I don't know, they want to hear headbang or heavy metal.
Yeah.
Because their brains are just wired a little bit differently, not right or wrong, just differently. And different people respond to different vibrations. And that's really a good idea for you to be playing music in your treatment room.
Absolutely.
Especially the kind of music that's so widely, universally upheld and accepted.
And we could even take it to another level. I mean, just over the last year or so, I discovered another vibratory option, which is the Solfeggio Frequencies. And these are tones that that resonate, some from the earth, and they're just tones that will interact with different functions and body parts and everything. It's just, amazing, but it's just tone. It's vibration.
Yes.
That's what it's all about.
Yes.
If we would like to tell a patient about that, how can they access that? Is it, can you something you get
Right
on YouTube?
Right on YouTube. Yeah.
Okay.
So tell your friend Lexi or Alexa, whoever.
Let her know in there.
I always wonder, how come he has so many patients named Alexa? He's always telling Alexa to do something. But okay, so let's go to one of your other modalities. How about cupping?
Okay, so cupping, that's been ancient medicine for a while, right? Chinese medicine.
Absolutely.
So different applications. Some people will use it for detox. That's a big quality, but what I use it is for any kind of like a lot of people get compressive therapy, so kind of the pin and stretching and pushing. But if you have something so tight and you just need to kind of release it and let the nerve, a cutaneous nerve, breathe, so to speak, I like to put the cup on so it pulls. It's called the skin and the fascia. So your fascia is just connective tissue layer. So basically, it's going to kind of pull it off your muscle, and then you have it. There are nerves called cutaneous nerves, and they're kind of more for like skin, right? Yeah. So basically what we're trying to do is we're trying to pull everything off so those cutaneous nerves can breathe, so they're not, as Dr. Orbach was saying, depolarizing, and then you're feeling the sensation. Yep. So
I have been cupped as a patient in the past. I mean, I had it in conjunction with acupuncture, and I just remember feeling this incredible, I want to say, energetic release. Like, I felt like my body felt like it was floating through space, not like I'm walking along on the hard concrete. And I don't know if it was time and place, if it was just so magical, specific to me. But anytime somebody brings up cupping, I go back to that experience, and it's just wow, just wow. And you see these Olympic athletes who wear like the female beach volleyball players are the best example, because they wear their sports bras and you can see these big cupping marks or welts on their upper back and their shoulders. And the cupping draws a lot of the blood to the surface. And so it almost looks like significant bruising. And so if you're not a cupping patient and you've seen people on TV who've been cupped and you see those marks, please don't be discouraged. That goes away so quickly.
It's not
and
painful.
it's really like when I adjust patients, I'm looking for the tightest places in their bodies to make these adjustments. And I know they sting for, I mean, we can argue back and forth. Was that the C fiber or was that the A delta? It stings immediately. I get that. And from my perspective as a patient, if I don't get that sting at that moment in time when I'm being adjusted, I feel like that was the wrong spot, or maybe you didn't adjust me all the way into the joint. And come on, man, I want that. But I get it. It stings. The cupping is different. It looks like it should hurt, but it doesn't.
Yes,
it absolutely doesn't.
Yeah, and what it's also doing is it's going to increase the blood flow to the area, so that's how you heal. I mean, you increase the blood flow so you could bring basically everything you need for your body to naturally heal itself.
I mean, you're so spot on about the blood flow. We, our nutrition store is as good as it gets. This is our nutrition store is the size of a good sized GNC. It's the products we have. I mean, sometimes I walk through and just take a look around and just notice how many new things we're bringing in by the week. But if you don't have this proper circulation to bring your nutrients and your oxygen through your body, it just doesn't matter. I mean, we could give you everything that the textbook says you should have and then some, and then we could write the textbook. But if your circulation is not happening the way it's supposed to, all of that is for naught. Absolutely. So that cupping, like I would go so far as to say, is like that could be considered a maintenance treatment. That just as I have patients who come every month, every 2 months, no falls, no accidents, I want to have my neurological tune-up, and I adjust them. I'm surprised. I mean, maybe it's our fault for not promoting this. Come every 2 months and just to have maintenance cupping to make sure that your circulation, especially in the lower body and in the lower legs, where people have a tendency to develop blood clots. Very healthy people have a tendency to
brings
blood
us
clots.
right to the boots. But before we get to that, I wanted to ask you, with your cupping experience, were you doing it just for a maintenance, or were you doing it for some therapeutic?
Well, I had never been exposed to it before, and the person who I was going through to acupuncture was she was so excited because she had just certified in cupping, and she was looking for bodies.
Here's my guinea pig.
Well, I mean, look, Matthew, my student mentee, who I began the conversation about, who's just so excited about treating patients. Man, I'm caught up in his enthusiasm. Like Matthew's classmates, those are guinea pigs. He was a guinea pig. You and I were guinea pigs.
Yes, we were.
You get to about chiropractic is a trimester program, not a semester program. So it's 3 terms a year, and it should be 10 trimesters plus or minus, depending on what's your course of study would be. You get to about trimester 8, your days of being a guinea pig are over. Yeah. So at this point, my acupuncturist cupping person, like she had certified in the technique, and she's done with guinea pigs. She's allowed to work on the public at this point. That's an important thing for everybody out there listening to know, that what Dr. Ross and I do. Look, at this point, we're not hurting people. We're not trying out new maneuvers because they sound cool. We're not doing human experimentation. We did. Those days are over. That was first year, maybe second year of chiropractic school.
Second year.
First year. Yeah. First and second year of chiropractic school. Yeah. At a certain point, like if you don't, you shouldn't do that to the public. You shouldn't do that to your fellow human being. but you do that to your classmates because that's how you learn, and they're doing it to you.
Yeah.
So that's it's important to keep in mind.
All right. Well, circulation, as you said, big issue.
Yeah.
All right. How do we address it?
Yeah, so we actually have something called a Pneumatic Compression boot. So we'll just, a lot of people, they say, well, doc, why do I have to do the Pneumatic Compression boots? Can't I just wear my compression socks? You can. That will definitely help, but that is just a constant compression. The Pneumatic Compression boots actually work off of, it's something called pneumatic compression. So a good example is end of your toothpaste, right? Some people will just kind of squeeze all the toothpaste out. Okay, I'm done. But what pneumatic compression is, for the people who kind of inch, all the way up to get every little bit out, that's exactly what they're doing. So it actually works towards it starts at your feet and kind of works more towards your head, so like more cephalad. So it's basically going to squeeze from the distal portion of your leg all the way up, like going up towards your head, and it's going to basically drain all the lactic acid out of your legs. And every time we move, our cells create waste. So basically what it's going to do is, and you don't have to just be like a marathon runner or an athlete. What it's going to do is it's basically going to push all the faulty metabolites and the metabolic waste out of your legs, get recycled in your lymphatic system, highly oxygenated, nutrient dense. And then so when you kind of like thaw out, so to speak, when the blood rushes back to your legs, you get all the good blood flow. It was actually studied for stage 1 varicose veins, and people with any kind of like lymphedema in their limbs, or if you have congestive heart failure and you have fluid accumulating in your ankles, just great to push it all out and get it recycled.
That was a great explanation.
Yeah, it was. I like the toothpaste analogy.
I just call it a blood pressure cup for your entire leg.
That's it.
That's what it feels like.
Pushing everything out, get the good stuff back in. Absolutely.
Good stuff.
The toothpaste analogy that really hit home. I mean, just is like creating those visuals that people can really understand and relate to.
Yeah, but I feel like speaking for myself, I think as well as you, what we're trying to do when you guys come in, it's just not about, we talked a lot about pain today. Pain is part of the pie, but we try and improve function.
Yeah.
So just like what Dr. Orbach was saying, myself included, I would love to say, go talk to a patient. Hey, Cindy, how was your day? Well, actually, I was able to pick up my grandkids off the floor yesterday without any pain in my back. That's like the biggest win, you know?
That's right. That's right. Well, I remember on our old paperwork, one of the questions that we asked of new patients was like, what do you do that occupies your spare time? And it was amazing to me how many people couldn't even answer that question. They're like, I don't know, do you enjoy reading? Do you enjoy gardening? Do you hang out with your grandchildren? Do you kill children, your grandparents? It's okay. Like there's no wrong answer.
Yeah.
But that's such an important question, because you're going to say, well, I came here because I have such severe back pain. Well, obviously, my goal as a clinician is to help you get out of your pain. But my goal as a practitioner is also, what are we going to do to improve your function to the extent that, you told me you could play with your children in the garden for 10 or 15 minutes and then it started hurting. What do we do to bump that up to half an hour?
Yeah.
What do we do to get that to 2 hours?
Yeah.
And those are the measuring sticks. Those are the markers that we're really looking for as far as treatment plan goals. And I know that we talk about, we individualize and we customize each treatment plan to each individual, and we don't have stock protocols. I mean, we have certain systematic ways of looking at things, and it's like there's a reason why we do one thing first and we do something else last, and why we have to see how you're responding before we determine what we're going to do with your next visit.
Agreed.
I mean, that's how we customize it. But customizing it also means that we're monitoring, from a distance, we're monitoring your life and asking you, how are things going?
Yeah.
What are we doing to help you meet your goals?
Yeah.
What are we doing to make sure that 15 minutes in the garden is well on its way to turning into 2 hours?
It's not a cookie cutter approach. If there's a camera in both of our treatment rooms, you would see that every patient, it's something specific tailored towards them every single time. Yeah.
That's right.
It's improving your quality of life. If you are in pain, getting you out of pain, and then what are your goals? Do you like to hike? Do you want to be able to go on a long hike without experiencing any pain? Do you just want to feel better, move better, and just chasing patient goals?
Yeah, that's exactly right.
And these guys are as active as they sound, okay? Because I know that, basketball's a passion for Dr. O, jiu-jitsu, tai chi, golfing.
Oh, yeah.
And of course, now I just saw this huge garden he planted.
Yes.
So Yeah, we're looking
yeah.
forward to that.
Yes, we are.
Okay?
Yes, we are.
And I promise, whatever I take, I will cook, and you will get some.
Done.
Okay?
Done.
Folks, this is Dr. Phil Ross. This is Dr. Gideon Orbach. They're the anchors here at the World of Wellness. They could talk like this for another couple hours. Okay, but you're gonna have to come back next time.
Well, we probably will over lunch. But
Thanks so much, guys,
All right, this
for
is
giving
great.
us your time. Folks, we're still here. We've got another one coming up at 1 o'clock. Polina Petrusevich coming to us from Detroit, Michigan. So don't miss that. In the meantime, this is Dr. Ross and Dr. Orbach. Thanks, guys. Appreciate it.
Thank you.